Joining us this morning, cosmetic surgeon Dr. Camille Cash. Good morning and thanks for being here.
Good morning.
Now, if someone is contemplating plastic surgery, what are some of the things they should think about to safeguard themselves?
I think it's very important for you to understand who is going to be performing your surgery. That means your surgeon. What are their training? What's their background? What are their credentials? Then you also want to know where will they be performing that surgery. Is it going to be done in a hospital setting or an office? It's very important for patients to be very truthful and honest with the physicians as well. We need to know all of your medical history, what medications you're taking, what drugs you may have been using before the procedure. And it's very important for the physicians to know exactly all of the medical situations that the patients have. All those things. You also want to know what to expect from the surgery, what potential complications could there be, and what will be done in the event that there could be a complication.
Well, because most people don't even think that there are going to be any complications. Most people think, oh, plastic surgery, one of the easiest types of surgery there is, I'll just do it and that's it. Not the case.
Not at all. This is plastic surgery. It is still surgery. And even in the most controlled situations and settings, there are potential risks and complications. We try to minimize those potential risks, but it is still surgery and there's still risks involved. Now,
the risks involving double procedures at the same time must really be elevated.
I think with, in an appropriate situation, an appropriate setting, you can do multiple procedures in one time. What you do want to do is you want to safeguard the patients. You want to make sure that the appropriate measures are being taken, that their body temperature is being monitored, that the blood loss is being watched. And so we do like to see that the procedures, even if there are multiple procedures are being done, we like to see surgery to be completed within about a 6 to 8 hour window. But multiple procedures can be done safely. But again, you have to have a surgeon that's experienced, an anesthesiologist that's experience with these patients and these procedures to safeguard them and prevent any potential complications.
And whose responsibility is it ultimately? Because in Kanye West's mother's case, there was a doctor that did not want to perform the procedure on her because she had a medical condition. Sure. Who is responsible ultimately for making that decision whether that person goes under the knife or not?
Well, ultimately, it's the surgeon's decision. It's the surgeon that has the initial contact with the patient. It's the surgeon that's going to see the patient after surgery and for long-term follow-up. So ultimately, the surgeon has to be aware of all the medical conditions for the patients and make recommendations. Does this patient need to see an internist? Do they need medical clearance? Do they need more further testing? And then work in conjunction with an anesthesiologist who will be closely monitoring that patient during the procedure.
One final question. This is regarding other types of body type surgery. Is there a difference when there's facial surgery in comparison to, let's say, the tummy tuck and or the breast reduction that Donde West's mom had?
Sure. With larger, what we want to look at is when patients are undergoing surgery and the face is a smaller area as opposed to the abdomen or the breast area. You want to just make sure that the greater surface area, one thing that's important is making sure that patient is warm. So if you've exposed a larger surface area of the body, then you want to make sure that those factors are taken into consideration.
All right. Thank you so very much, Dr. Cash, for joining us.
And you can get more information on plastic surgery, do's and don'ts, on our website. Just click on the Morning tab.